Honor and profound privilege to stand before you today as the newly appointed Commissioner for Health in Zamfara State. I am deeply grateful to His Excellency, the Executive Governor, Dr. Dauda Lawal, and to all the stakeholders present here for the trust you have placed in me. Together, we are embarking on a journey that holds the potential to transform the health landscape in our beloved state. And I'm excited to lead this charge alongside all of you. Recall, in January this year, His Excellency, the Executive Governor of Zamfara State, declared state of emergency in the health sector as a result of several challenges facing the sector, including a high burden of infectious and non-infectious diseases, inadequate healthcare infrastructure, limited access to healthcare services, and under-resourced health workforce. As the newly appointed Commissioner of Health, I find it imperative to quickly understand the situation, build strong partnership, and implement effective policies to improve the health system in line with the rescue agenda of the government. My vision and commitment. First, let me affirm that my vision in the Ministry of Health is one of inclusivity, accessibility, and transparency. I will provide a purposeful leadership with a strong commitment to ensuring that every citizen, irrespective of where they live, has access to the care they need to live a healthy and productive life. To achieve this, I'm coming on board with 6 pillars that will guide our team in this assignment. My 6 pillars will focus on core areas as follows: strategic engagement with the critical stakeholders, assessment of health system gaps, immediate action to improve health service delivery, health awareness and community engagement, monitoring and evaluation, and then lastly, building institutional capacity. Realistically, our journey will certainly not going to be easy. However, I believe that by working collaboratively with all stakeholders, including government agencies, development partners, professional associations, civil society organizations, and community leaders, we can overcome this obstacle and make meaningful progress. Zamfara State has the potential to be a leader in health innovation in Nigeria. To achieve this, we must harness the power of partnership. At this point, I would like to recognize the critical role being played by development partners and donors in all areas of development in our state. I want to express my deep appreciation for your continued support. Your contributions are invaluable, and I am committed to ensuring that our collaboration becomes even stronger and impactful. Together, we can build sustainable programs that will not only address immediate health needs, but also lay foundation for long-term improvement. To the head of various health agencies and boards, I encourage you to work closely with the Ministry of Health in designing and implementing policies and strategies that meet the unique needs of our state. Let us not work in isolation, but instead foster a collaborative and inclusive approach, ensuring that each sector's expertise and resources are optimally leveraged for the greater good of Zamfara's health system. I received a marching order from His Excellency, the Executive Governor of Zamfara State, to do all that is humanly possible to ensure improvement in our health indices. It is therefore imperative to state categorically that our primary focus must be on strengthening the primary healthcare system. It is at this level that the majority of our population interact with health services, and it is essential that we make this the foundation of our health system. We will ensure that primary health facilities are adequately equipped, well staffed, and accessible. I am committed to working with local government communities and development partners to ensure that health services reaches even the most remote part of our state. I will not shy away from my responsibility to ensuring that I deliver on the mandate given to me by His Excellency, the Executive Governor of Zamfara State, on improving the health indices in our dear state. It is at this point that I wish to announce that all appointment of program officers into various programs within the ministry and its agencies are now on probation. Periodic review of performance will be conducted and will serve as the basis for appointment or replacement of program officers. To effectively ensure coordination of various programs within the ministry, I will immediately inaugurate the Central Coordination and Delivery Unit in the ministry that will coordinate program delivery, continuously monitor, and periodically evaluate the performance of various departments and units. It is my belief that a well-trained and motivated health workforce is the backbone of any health system. We will therefore prioritize the training and capacity building of healthcare workers and also ensure that staff of the ministry are trained and retrained in key areas such as health system management, budgeting, data analysis, monitoring and evaluation, so that we collectively develop and implement evidence-based health policies aligned with the national health priorities and international best practice. By, by investing in human capital, we will be able to address the challenges we face. We must also address health promotion and disease prevention. While treatment and care are critical, prevention is equally important. By investing in awareness campaign, vaccination program, maternal and child health services, and initiative to combat communicable diseases like malaria and polio, we can reduce the burden of our health facilities and ensure that the future of our people. It is the aspiration of His Excellency, the Executive Governor of Zamfara State, Dr. Dodolo, to see that all residents of Zamfara State have access to quality healthcare services, irrespective of their social status. We can therefore not afford to leave anyone behind. We must ensure that our policies and programs cater to the need of all residents, regardless of their economic status, gender, age, or geographical location. We will focus on health needs of women and children who are often the most vulnerable and ensure that rural and underserved communities have access to same quality of care as those in urban centers. We intend to achieve this noble idea by strengthening our state social contributory health care scheme being managed by Zamfara State Contributory Healthcare Management Agency, leveraging on innovative financing models, including public-private partnership. In conclusion, I want to reiterate my belief that the key to improving healthcare services in Zamfara State lies in collaboration. The challenges we face are not insurmountable, but they require the collective effort of all of us in this room and beyond. Together, we can make Zamfara State a model of innovation, good health, and well-being for all. I pledge to work tirelessly with open door approach to ensure that health system is strengthened and that every resident of the state has access to health care they deserve. Inshallah. I honestly and sincerely ask for your kind support and ideas and commitment as we embark on this journey. I look forward to working closely with each of you in the coming months and years. Inshallah. Thank you for listening.